Hello, everybody, and welcome. Good morning, and congratulations on being here at your orientation. Welcome to the Robert Wood Johnson Barnabas Health family. And thank you, Myrna, for that beautiful introduction. I'm so sorry that I can't be with you today. I always have so much fun being there, but this is second best. So, welcome to Robert Wood. Again, my name is Katie Carroll, and I am a nurse here in pediatric same-day surgery, the 7th floor of the Children's Hospital. So if you guys ever want a beautiful view of the sunset, I'd come up to the 7th floor. We have one of the best views in the hospital. So I wanted to start by saying that I haven't always focused on self-care and self-preservation as a nurse. I just celebrated my 22-year anniversary as a nurse last month. And it's kind of hard to believe because I'm still only 29 years old. So how can I be a nurse for 22 years? But all kidding aside, I started my career, as I'm sure most of you did that are experienced nurses being here. And even if you are a brand new nurse, just graduated, took your boards, sitting here in orientation, I'm sure you feel the same way, that you are ready to dive headfirst into the deep end of the pool of this beautiful career of nursing, because it's a long journey to get to this point, right? You thought about being a nurse. You probably are one of the caretakers in your family. Anybody else the firstborn? I'm the firstborn. I have two younger brothers. So I feel like I was born into this nurturing role. I've been babysitting my whole life, ever since I was 12 years old. And so I think it was only fitting that I became a pediatric nurse. But we dive head first and we don't look back. We kind of just jump in thinking, okay, this is it. I graduated, I passed my boards, and now here I am ready to serve. I always ask everybody in the room, I'll say, does anybody remember when you were graduating and you were receiving your diploma? Was there anybody there on the side saying, by the way, you're never going to be able to take care of yourself again, so you can just forget about that? Right? We don't remember anybody there saying that, but by the nature of our profession as a nurse, we are taking on a profession, a career where we put our patients first. That's what we're trained to do. That's what we get paid to do. We get paid to punch into work and to put our patients first. The problem is that 5, 10, 22 years into your career, if you haven't taken care of yourself, you will start to notice the effects that the lack of self-care on yourself has on you. And so that's why I'm here today. In my time with you today, this is your time during orientation where you could just take a deep breath and focus on you, right? There's been so much that you have had to learn already in orientation. A lot of it is heavy and stressful and serious, as it should be. But the time with me here is to learn how to fill up your cup, learn the importance of why you should be filling up your cup. A lot of people think that self-care, and myself included, we think that it's all the massages and the manicures and the pedicures and eating dark chocolate and drinking wine. And believe me, I enjoy all of those activities and I do them on the regular, but they are not the things that are going to help you sustain yourself in this career. I just had a coworker retire about 3 years ago, and she was 45 years at the bedside, right? Let that sink in. I know I let it sink in. I've been 22 years at the bedside, and I think, man, that's another full 23 more years at the bedside if I'm going to live up to the amazing career that she had. So today we're going to talk about self-care, self-preservation. We're going to talk about stress and burnout and distinguish between the two. And we're also going to talk about ways where you could learn how to fill up your cup while you're on the job as well as while you are home. 22 years as a nurse. Believe me, I know that there's not just, 30 minutes in my day, 60 minutes where I'm going to take a walk around the hospital, go outside, breathe in the fresh air, go to the meditation room that's in Children's Specialized Hospital and sit there for an hour and meditate. I know that that's not realistic as a bedside nurse. But what I want to point out today is that it's the little things that matter. The little things in life add up. So I want to talk first about stress and burnout. There is good stress and there's bad stress. Good stress is planning a wedding, having a baby, starting a new job, right? This is exciting, but it's also stressful at the same time. There's also bad stress, losing a loved one, losing a house, losing a job. So I want us all here to picture a plate of life. And we all have the same size plate, but there's just different things on everybody's plate. Maybe you have kids, you don't have kids, maybe you work 2 jobs, 1 job, maybe you're also in school, you're on a committee or 2. So the thing is when you're stressed, right? We all know what happens in the body. Our cortisol levels go up. We also know that our blood pressure rises, our heart rate could rise. We could increase our respiratory rate, like all the things that we know as nurses. But what is it really doing to you? If you think about having too many things on your plate, right? Let's say you work here full time, and then you also teach your child's CCD class, and then you're also on a committee at work, and then you've also volunteered at your church festival this weekend, and you feel yourself stressed out, right? And what does that look like? That looks like not getting enough sleep, not eating right, being short with your family and friends. And when you're trying to do all the things, let's be honest, you're really not doing any of them very well. So when you're stressed, you picture this plate that we have, right? And you picture all the things on your plate. You feel like if someone could just take one thing off your plate, you feel like, you know what? I can't really volunteer at that festival at my church this weekend because there's just too much else going on. And I feel like if someone could take that off of my plate, that I'll be okay, right? There's still a sense of hope there. There's a light at the end of the tunnel. You just feel like it would lighten the load enough so that you can do all of the other things well. You can continue to work your full-time job. You can continue to teach your son's CCD class. You can continue to show up at your committee once a month, right? I want to I wish I was there with you guys right now because I always love looking around the room and seeing who's going to raise their hand. But how many of you would consider yourself an overachiever, right? How many of you would consider yourself OCD type A? I think that that's just inherent as nurses, right? The thing is, as nurses, we feel like a lot of times more is better. I always say that I always feel like it's a knife to my heart when I have heard people over the years, not nurses, people say to me, "You're so lucky. You only work 3 days a week." And I just smile because I know that they don't know what goes into those 3 days, right? 3 12-hour days is what I've been doing for 22 years. Believe me, I don't want to work 5 days a week. I'm going to be honest. I love my days off. I love my Tuesdays off. I go to Target. I do my food shopping. And I'm used to that now for 22 years. But what I think happens as overachievers is that we think, you know what? I work 3 12s. I could totally pick up a per diem shift, right? Or per diem job. Anybody else do that in their career? I've done it many, many times. And then we also think that, oh, you want me to come in extra tomorrow for 8 hours? Sure. You want me to stay tonight an extra hour or two? Sure. But eventually it catches up to us. And one of the things that I want to stress today is boundaries. As nurses, when we are in the hospital and taking care of our patients, and their families. Let's be honest, right? As a pediatric nurse, there's always someone with my patient, his or her mom, dad. Before COVID, both sets of grandparents and the mom and dad would come into same day surgery for the child's ear tube surgery, right? And you're taking care of a lot of people. If grandma's in a wheelchair, mom's pregnant, she hasn't eaten, she's dizzy, she needs orange juice. We're constantly giving, giving, giving. But what happens when you go home? Who do you go home to? Whether you go home to yourself and you're taking care of your house, you're paying your bills, you're doing your laundry and your food shopping, whether you go home to a spouse, kids, parents, a sick parent, siblings, neighbors, right? One time my husband went in the basement, and he's tall and has a shaved head, and he came up the stairs and his head was bleeding. He had cut his head on one of the pipes. So right away I went into nurse mode, right? It was like, okay, honey, let me clean that up with a little alcohol, little bacitracin, and a Band-Aid. And he said, honey, stop being a nurse. And I said to him, I can't. Because it's who we are. Like I said, I'm pretty sure that most of you can look back at your life and say, I'm not surprised I became a nurse, right? You're the nurturer, you're the carer, you're the giver. What happens then when you're at home and somebody asks, can you help do this favor for me? Can you help babysit? Can you take me to the airport? Can you volunteer at this function that we're having? Can you come into work tomorrow? Please, please, please. We're really, 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 really short. And what do you find yourself saying? Okay, I will. But your gut is telling you no. It's like screaming on the inside, right? But you just force yourself through and you think, okay, well, I might as well work. It's extra money. Who can't use extra money? But what happens when you continue to do that month after month after year? You may notice, you may look back and say, wow, I haven't taken care of myself in a while. And I'm not just talking about going for a massage. I'm talking about, wow, I haven't been to the doctors in a year. I haven't been to the dentist in 5 years. I haven't gone for my annual mammogram screening, whatever it may be, in 2 years, right? So your health is suffering because you feel like you have to constantly give, give, give. And what do we think? We think when our head nurse director is begging us to come in extra tomorrow because so and so is sick and so is on a leave of absence and we're going to be short. And you feel like, if I say no, is that going to make me a bad nurse? Are people going to talk about me? Is my boss going to not like me? Are my coworkers going to be mad at me? It's time to get over it. Right? 22 years in, and I can say with strong belief and conviction that I don't stress myself out like that. My coworkers actually joke when the overtime list comes out, if I'm looking at it. They laugh and say, are you really going to sign up for a shift? Because you never sign up for overtime. That's right. I don't. I rarely sign up for overtime because I have a life outside of my nursing where I have a coaching business. I have a life coaching business. So, yeah, sure, it would be great to work an extra shift, but I'm also focusing my time and energy somewhere else. And that's what you have to start to think about when somebody asks you, can you do an extra shift? Can you do this for me? Can you do that for me? What is it costing you? What is it costing you financially? What is it costing you mentally, spiritually, and emotionally? So that's all talking about stress. And I want to talk a little bit about burnout. I think that a lot of people throw stress and burnout in this one big bowl. And we just say things like, I'm stressed, I'm burnt out, I'm overwhelmed. Now, believe me, we can all agree that these past 18 months, 19 months, 20 months has been stressful, overwhelming for the entire world. But as nurses, right? I'm sure we've all heard the stories. If you're coming from another facility, organization, if you've been a nurse for a while and you've worked through the pandemic, if you were going to nursing school through the pandemic, graduating during COVID, starting a new job as we're still just living in another chapter of COVID, We all know the stress, overwhelm, and burnout that caretakers are feeling, healthcare workers. Healthcare workers have left their jobs earlier than expected. Maybe they weren't expected to retire for 4 or 5 years, and they have left because of the stress. And sadly, some healthcare professionals have taken their lives during COVID due to the stress and overwhelm. So, this is a very, very serious topic. And that's why when I say self care and people think, oh, yeah, go for a massage, go on a vacation. If you go on a vacation and you come back and you walk in and two people called out sick and the label maker's not printing and the pump that you turn on is making weird sounds and it's not working and the ER is calling you for an admission, the fact that you just went on vacation is not going to help the fact that now you were in a stressful situation, right? I always joke that, I do a lot of yoga and I always ask everybody, are there any yogis out there? But I don't say you should do more yoga because then it'll make it better at work, right? Some people say the fact that I walk into work and I'm walking into a stressful situation, I don't say, oh, I'm so happy that I did yoga yesterday. It's going to totally make everything better today. Not the whole truth, but there's a little bit of truth in there, right? And that's what I talked about at the beginning here are the little steps that are going to help you over time. One time I had a challenging situation with a patient and his family before his surgery one morning. And it was his father who was getting very, very upset at the bedside, very heated. It was very uncomfortable. I was there with the surgeon and the anesthesiologist, and it was not a comfortable situation. But as the nurse, we know that we're the professional. So we have to stand there and continue to be the nurse and take care of the child as we're absorbing everything that's happening. Well, when I stepped away from that situation and I walked over to the nurse's station to do something, one of my coworkers looked over and said, I saw you doing your yoga breathing over there. And I said, What? What was I doing? When? And she said, I know that situation over there with that family was very, very challenging. But when I looked over, you looked calm and you were taking these long breaths. And she said, there goes Katie doing her yoga breathing. The thing is that I was still in a stressful situation that I couldn't get out of at that time. But I was tapping into a tool that I have learned in my yoga to help me when I'm stressed, right? And in that moment, my breathing helped me. And breathing is free, right? Like, hello, thank goodness, right? We have our lungs breathe for us. We don't even have to tell them what to do. They just do it and we breathe. So that's one tip you can use. The next time you find yourself in a challenging situation at work, take a breath. It's okay to take a breath. Does anybody else feel like sometimes you go through your shift and you're just not even really taking a deep breath, right? You're just going, going, going. You're moving, 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 right? That's what we do as nurses, right? We're multitasking. There's a million things on our mind. But when do we take that moment and say, you know what? I need a minute. Taking a minute, taking a day off doesn't make you weak. And what I have learned in speaking to nurses and healthcare professionals, especially doctors, is that they feel like if they show their vulnerability in a situation, they'll be seen as weak. And that is a sad state of affairs because what happens then? You keep pushing through when your mind and your spirit and your body are telling you that you need to take a break. And then what happens? Who knows? An emotional breakdown, a physical breakdown, a massive heart attack. I'm sure we've all heard those stories of people that were so stressed, right? And then what happens? You're not taking care of yourself, mind, body, spirit. And then they have an event. I don't want you to have to wait for that event to happen to say, oh, yeah, now's the time I should start to take care of myself. No. So in nursing with stress and burnout and overwhelm, I want to tell you guys a story. as we are starting to wrap up our time here together. I wish I had even more time with you guys, but I spoke at Dell Children's Hospital pre-COVID during Nurses Week, and this is a talk that I gave on self-care, self-preservation for healthcare workers. And I met with their chaplain during that time. And I loved our time together because she runs a resiliency program there for all of the workers at the hospital, not just nurses. And she gave me this analogy that I still use to this day in my talks because I feel like everybody can picture it and everybody can probably at least have one story that they can add to this analogy. So this chaplain said that everybody starts their healthcare career with this beautiful walk-in closet, right? And I picture that because I hope to have that one day, right? Like I picture this amazing walk-in closet. It's all white and it's all ready for all my clothes and shoes and bags, right? I know maybe some of the men can't agree with that, but maybe you can. So the thing is we start our careers, we have this closet, and this closet is going to house all of our experiences as a nurse, the things we see and hear and feel and touch during our time as a nurse. I worked in the pediatric emergency room for 4 years, and believe me, some of the things that I saw and felt and heard and just everything during that time stay with me all these years later. So I want to share with you one of those stories. So I was walking into work one morning, 7 a.m. I had my cup of coffee in my hand and I was punching in. And the night shift charge nurse made a beeline for me, like she was coming for me. And I punch in and she says to me, Katie, I need you to take the patient in CC1. She's a 5-year-old asthmatic and she passed away about 20 minutes ago. Her family's in there saying goodbye, and I need you to go in there and clean her up and take her to the morgue. Right? Let me tell you, if I did yoga the day before, coming into something like that still wouldn't have softened the blow of that story and what was just put on my plate. I did take a deep breath. Took a very deep breath. I set my coffee down and all of my stuff, and I prepared myself, right? As nurses, we prepare ourselves. We kind of like put on a shield of armor because we can't go into the room and fall apart. We have to be the strong one. And I walked in the room, and there was a beautiful 5-year-old girl laying on the stretcher, and her mother was strewn over her. And her family members were all surrounding her, and everybody was crying. And the mother was sobbing, heaving sobs over her child. And to this day, when I talk about it, my heart skips a beat. It beats a little bit faster. My palms get sweaty because it was a very, very emotional experience. And I stood there and I handed out tissues and I rubbed the mom's back and I got water for the mom. And then we escorted the family out. And I cleaned up this beautiful little 5-year-old girl, and my coworker and I took her to the morgue. This was my first time going to the morgue. And I had been a nurse at that point, maybe 13 years. And I will never forget the walk to the morgue. I'll never forget the security guard opening the door, walking in, having to sign my name on a piece of paper, my patient's name, and then delivering my patient into the morgue amidst the other deceased bodies. I will never forget it. It was cold. There was a smell. And I had to take that all in. And then I walked back to the emergency room with my coworker. It was a very short walk. And I'm trying to process what just happened. And I walk in, and now it's later in the morning. Everybody's bustling around, and the day shift charge nurse is coming for me. And she says, Katie, I need you to triage the kid in room 4, sprained ankle. Go. Because that's what you do in the ER. And I had to walk into this room, smile at this kid and his mom, and say, hey, buddy, what happened? You sprained your ankle? Okay, what's the pain on the pain scale? Let's get you an x-ray and some Tylenol, right? I had to take what just happened with that beautiful 5-year-old girl, bringing her to the morgue, and I had to throw it in that closet. I had to open the door and throw it in. because I didn't have time to process it in the moment. And we don't as nurses. The thing is that we constantly do that in our nursing career. We take things and we throw them in, stories, experiences, because we don't have time during our shift to process it. But what happens over time is that door, it doesn't close anymore, because it's just so much stuff is inside that the door just starts to open. And now you don't even want to look at it. So you're just throwing things behind you without even looking. And there's stuff on the floor, it's spilling out, right? All of these things that you have experienced. And maybe you're feeling it. You're not sleeping well. Maybe you're drinking more. Maybe you're addicted to something, drugs, alcohol. You have broken relationships. Maybe you've gained weight. You haven't lost the weight. You're going to the doctors more. You have headaches. You have back pain, because we haven't addressed the things that we've taken on. We're empaths. We're empathetic. We've taken on our patients' feelings and emotions and the families. It's what we signed up for as nurses. But I'm here to remind you that your health and wellness is just as important as your patients, right? Your patients' lives depend upon you showing up as your best self. So that's why it's vital for us to learn how to fill up our cups. Our health and wellness are just as important. At the beginning of COVID, my brother, who's a type 1 diabetic, said, everybody's saying that we're all in the same boat. We're all in the same boat. And my brother said, we're not all in the same boat. We're all in the same storm, but we're all in our own individual boat. And my question for you today is, how are you building your boat so that you can sustain yourself in the longevity of this career, but also in your life? Thank you all so much. I look forward to meeting some of you and seeing you around the hospital. You can find me on Katie Carroll. My website is katiecarrollcoaching.com. You can find me on the social medias at Katie Carroll Coaching. If you have any questions, please contact me. I'd love to hear from you. Congratulations again, and I hope that you guys have a wonderful day. Thank you so much.